So how did you get interested in palliative care?
I had my dad who died of cancer of the throat, and really affected me. And I had my uncles also die of cancer of the throat, so I have a personal experience with cancer. So this made me like do palliative care.
And in your nursing program, did they teach anything about palliative care?
No, not at all.
So how did you find out where to do training for that?
I just heard about palliative care and I searched, and we had this organization, Kenya Hospice and Palliative Care Association, wanted to train some healthcare workers, and I showed the interest, and they paid my tuition to do the diploma at Kenya Medical Training College here in Nairobi.
And then you went back to Garissa?
Yes, I did. At that time, we had a palliative care unit,
Okay.
but nobody was working at that time in the unit. So I started working there while I was still a student.
Okay. Wow. What brought on this next phase? Like, what made you finally realize we need more support, we want to help these patients more?
You know, I was always thinking on how to help our community, but I didn't have where should I start, because I'm new to this thing. So I had some journalists, Hussein and Amira, who had an interest in cancer because they've lost their relatives or their close people die of cancer. So they had an interest and they wanted to and bring this cancer thing and like create awareness that we have patients who are dying of cancer and they need help. So they came with the idea, and I already had the idea.
So when they approached you, said, I've already been thinking about this, let's do something together.
It was so good.
Yeah.
So we did a film on cancer patients. We are still working on it.
Okay.
Yeah. And then we sat and we were like, now that we're doing the film, what else can we do for the community? And we started a community-based organization.
Okay.
We want to create more awareness and probably do screening.
Okay. Where would you want to do the screening?
Garissa County.
For all types of cancers or more for breast cancer?
All.
Okay, and not just for women, for
No,
men, women,
for
children?
everybody, adults and pediatric.
That's wonderful. And when are you hoping to do that?
By February next year.
Okay, wonderful. And you feel like because it went well this time, you feel like the community is open to having this kind of discussion?
Yes. We want to go deep into the community.
Yeah.
Because cancer is with us, and it's affecting all race. It doesn't matter whether you're different race. So we want to reach deep into the community. We have medical ward, we have male medical, we have female medical, then we have the gynae ward and maternity, and the pediatric ward.
Okay, but that's as specific as it goes. You don't have oncology, obviously.
No, we don't.
Or TB.
We have a TB, but it's an outpatient clinic.
Oh, okay. Who pays for the hospital? Is it a government hospital?
It's a government hospital, but it's cost sharing. Patients pay services.
And if they can't afford it, is there kind of
nothing?
They just Do most of the people who live in Garissa, they've been there for many years, or some of them are more recently coming from Somalia?
No, they've been living there
for many years.
Yeah, many years.
Okay, so they're not new from Somalia or anything.
They're not new, but we have new.
You occasionally, or maybe someone's family or something.
Yes.
Okay, so that also must be a challenge.
Yeah,
they're coming from Somalia to Kenya.
They come to Kenya.
Yeah. Okay, so that's good.
But maybe in the rural setup, they're still delivering at home.
Yeah, you wouldn't even know that.
Yeah, we wouldn't even know. Yes.
But the maternity ward is full.
But even we have women who are in the city or in the town, they are still delivering. They prefer because of privacy. In public hospital, there's no privacy.